All right, folks, we'll get started. We're a couple minutes late, but the Ghost of Howard isn't here today, so don't worry about it. We'll start out with a roll call, please.
Okay, Delaware County, Mr. Early is excused. He is in a better place at Florida. Lou Jones.
Yes, sir.
Patrice Delmeter.
Yes.
Aggie Wilson.
Here.
Hey, Gold Star, just about. Fulton County, Yvonne Hart is excused. Jack Farquhar.
Here.
Jill Dunham.
Here.
Chris Georgia, I don't know if his membership is still in place or not. Explain that shortly. Hamilton County, Joyce Belletti.
Here.
Bill Belletti, present. Joe
Here.
Montgomery County, Tom Pasquarelli, not here yet. Mickey Swartz. Here. Patricia Green.
Here.
Tony Agresta.
Here.
Otsego County, Sid Chase and Brian Knapp are excused. Dr. Marquis, I haven't heard from. I presume he's working. He's normally very good about requesting an excuse. Dana Wygant is working, and Rick Kirschman is excused. How about that? So Harry County, Andy Cuccinello, haven't heard from. Ed Brandt, haven't heard from. Bill Beavers.
Here.
Mark Zeke.
Here.
Dr. Leinhardt.
Here.
We have a quorum, sir.
All right, welcome everyone. Everybody got a copy of our minutes from last month's meeting? Need a motion to approve?
I'll make a motion. Who's that?
Motion by Mickey. Second? Gary.
Second. Okay.
Motion has been made and seconded to approve. All those in favor signify by saying aye. Aye. Opposed or abstained? We have a guest here today.
We do indeed. We have Deb Cuffs from Hudson Valley Paramedic Program. We have Don Coy and Bonnie Bergman. Don is with Fulton County 911. We have Beth McGowan from CMT and Steve Collins from Northampton. Welcome one and all.
Correspondence, I'll give a copy of the correspondence. Looks like we killed too many trees this time.
Not too bad. Almost didn't get a copy of the correspondence because our nice new copier at the office decided to act up strangely, the way only computerized copiers can act up. I told it one thing and it told me another. You'll notice the financial handouts are printed sort of landscape rather than the long way on the paper, and that's because of the way it was acting up. So I'm happy we're able to have the handouts that we do.
Okay. I really don't have a report. Go right on to Secretary report.
Okay. We sent out Health Commerce System registration information to all the agencies last month, and we sent them out to all the agencies for which we have a working email address, and that's a little bit like complaining about people not being at a meeting because only the ones at the meeting are the ones present. The people who aren't there obviously aren't, and so I have email addresses for 83 agencies out of a total of 109. Most of the addresses I don't have are for the BLS first responder agencies. I certainly would like to include them. Technically I don't have to because they don't come under the purview of the health commissioner. Technically, that's only a technicality. I would like to include them, but there are a few regular ambulance agencies that I don't have working email addresses for. So if you could go back to your respective areas and please urge the agencies that you're aware of that are not getting our email, please urge them to get in touch with me with a current working email. I would greatly appreciate it. Mike Taylor at the Department of Health has provided considerable tutorial information to us to assist in the Health Commerce System registration process, and believe it or not, it is going forward in our region. It's going forward slowly, and my understanding is that it's going forward slowly statewide, but it is going forward. So all you have to do is to click on that email address I sent out to everybody for an agency rep, and register and get a user ID, and then send me a copy of your user ID and a photocopy of your driver's license. I need that to complete your registration. That's not my idea, so please don't blame the messenger. I need the photocopy of your driver's license and your user ID that HCS will give you when you initially go in there, and then I can complete your registration, and then you're all set as the 24/7 Ebola contact person. On December 1st, we received a new budget and training plan template from Lisa DeLong of the Department of Health. It's supposed to be returned electronically by the 4th of January. And this month, we did not receive any notice of enforcement actions. Does that mean that everybody has been behaving themselves?
Of course.
I'll let you all answer that question privately. And that serves my report.
Very good. Moving into the treasurer's report.
Okay. Treasurer's report, I have, once again, it's printed sort of strange looking, but it's printed nevertheless. The old adage, if you want to really follow things up, use a computer. A printed report of the cash flow and balance sheet has been delivered to the committee members present. Lou and Jack Farquhar have taken a look at it. Sid and Tom will be provided copies of it either next month or if Tom gets here today. So they reported.
Yeah.
Everything was in order and accurate.
Very good.
Okay.
Okay, we need a motion to accept the treasurer's report as presented.
Yep.
Motion by
Okay.
have a second? Second. Second. The motion has been made and seconded. All those in favor signify by saying aye. Opposed or abstained.
Abstain.
Listen to all our staff members.
Committee reports. Anything on program agency?
No, don't have anything on the program agency.
Training?
Nothing on training I can think of.
Okay. I suppose it could come under training, it could come under something else also, but we're still waiting, we being everybody in the 6 regions that have adopted the collaborative protocols, we're still waiting to hear about the Android application. It is not yet complete. Nobody seems to know why it isn't yet complete, but as soon as it is completed, I will send information out to everybody on how to download it. It's a free download, and what the link is, and so forth. That's all I have for that.
Have you heard anything about getting a printable copy of the new protocols?
Yeah, I received it. I'm glad you reminded me. I received from Tim Mirabli. It's in the correspondence, but I forgot to mention it. I received from Tim Mirabli yesterday a pristine, clean copy of the new protocol. I will send them out to everybody. I will see that everybody gets a copy of them. And you can have more than one if your copier works, or if you have a color copy. Yeah, I will send those out tomorrow.
All right. Transmission standards?
Nothing to report. No news.
Anything at all from the state yet, Mark? Your next meeting next month?
Yes, sorry, I was making a note. We're still meeting on the 13th and 14th next month. Donna sent out an email notice to make sure we all got our hotel rooms, and I inquired because her message said that the government rate, of course, is only available to members. So I wasn't quite sure about what my status was going to be, so I said, I don't want to presume that I'm going to be a member, but what do you know about Tom Pasquarelli's vetting? And I got a note back saying that she hasn't heard a word and has no idea when he's going to be vetted. So I'll be going to the meeting, unless I hear otherwise between now and then. So I got my hotel room.
At the approved rate.
At the right, yeah. At the approved rate, right.
Okay. Regional program?
Joyce, I guess you could deal with the policies and procedures under this.
You want to do Ebola? Okay.
We'll take all? Yeah.
This morning I distributed the policies and the procedures, the sample SOPs for Ebola for each agent, for an agency, and I think you also sent them out by email to all the members?
Yesterday.
Okay. We, basically the people who were here this morning read them over. I got a few responses, a few little ditties here and there to make corrections. I have incorporated, to my knowledge, at this point, all the updates. Now, who knows whether there's been an update this morning, but to my knowledge, all the updates that I received from the health department are in here now, and this should be the latest. So the only thing I'm waiting on is the REMAC approval for the personal safety algorithm.
I spoke with Dr. Leinart this morning, and he can certainly speak for himself.
Yeah.
Yeah, it looks fine, and we're all following rules written by others.
Yeah, these are the current, also the current guidelines from the CDC that so far that are there. So I'll put these down then as approved by the REMAC, and that's the only thing I was waiting on. I will then, after, if I'm going to give you like 2 or 3 days, if there's to read them through, the ones that were sent out. If there's any other suggestions or any major disturbing factors in here that you can't deal with, let me know. But otherwise, I'll send these out then to the agencies, and you can go from there as far as making up your own, using these to make your own Ebola policies and procedures up. The forward basically is just, it doesn't have to be in there for when your agency makes them up. It's just a little bit of a something I put together for a little bit more information. But your agencies are going to have to take this, adapt it to what they're doing, what PPE they're using, and so forth. So there's going to be some definite adaptation needed. You can't just take this and make it your own without any changes. So
It is a Word document, so it can be
yeah,
easily changed.
you can change this however you want it. And I will attempt. I'm attempting to put the addendum in, but I'm having trouble inserting PDFs into this Word document. So the addendum that I had planned to put in may not be in there. I'll just have to take them out.
Is that the CDC filter?
Yeah.
I can send that to you as a...
Do you have a Word document?
Oh, yeah.
Okay. Yeah, you could send it's the CDC Ebola response preparedness thing. Check off the list.
I can for you. Basically, you just scan it in as a graphic and then set the graphic into the Word page.
Okay, if you could do that. It's not working. It's not working taking the PDF and putting it in here.
That's the one-page thing, or that's the...
No, that's multiple page.
All right, I got that. I'll scan it for
This was yesterday.
I received the MedWatch. Yeah, I don't think you hit send. I received the sodium,
No.
You didn't send the out?
I did send it out yesterday, yeah. Nobody got it?
No.
All right.
Anyway, try again.
One other thing on that was, I was showing you on the, if anybody has any questions on programs, I know counties have been doing it and all that stuff, but if your members want to go on to YouTube, Ebola PPE, it comes up with a whole thing on donning and doffing all of your PPE.
Yeah, CDC has the same thing, and I think we mentioned that last month. Gave you the address for that. There's very good videos on how to don and how to doff PPE. So
It will be interesting if any of us have to do one of these calls to see how long from start to finish it takes and how long your crew and your ambulance are going to be out of service, especially if you haven't pre-wrapped your ambulance.
Right.
I'm thinking somewhere between 8 and 12 hours, but I guess my suggestion would be if any of us do this, we ought to report to Joyce
is
our
to-
experience.
Yeah, please do.
And there are people in my area who are under 21 days of being observed.
Uh-huh.
We've been told that
Because of the possibility of,
they just came back from Guinea
oh, I see.
as
Saturday
a
or
physician,
Sunday.
and they clear on Saturday or Sunday. So, I mean, there are potentials in, there's been at least one potential in our area.
We have one now too.
And again, I would strongly urge the small volunteer agencies, especially those that have one ambulance, to make arrangements with some of the, make arrangements or possibly at least approach some of the commercial ambulances that have dedicated rigs and so forth. Because if an agency gets involved in one of these calls with one ambulance, they're going to be out of availability for a long time for their own areas. So
I think that's the intent of the department also.
yes,
To make these arrangements,
right.
regardless of primary operating territory.
Right,
And
and
I think
I,
we're all aware of that.
I did put a little note in there, and I put a section in there that you could, you know, that mentions an agreement with an agency. So,
My understanding is that rural metro has been designated by the state to make removals from hospitals up to the Upstate Medical Center or to the
Interfacility.
Medical Center in Rochester.
yeah, not pre-hospital.
Not pre-hospital.
Is that true, Bill? Because we heard afterwards that wasn't.
That's what
Actually,
we
we
were
heard it right
told.
from SUNY that they did not have a
Okay,
contract.
because
for
we were
that.
told
I
that.
was told yesterday that they will have, as of today, a dedicated ambulance that is pre-arranged, set
They
up.
told us even though they have that, if we have our own resource, they prefer we use it. That's what SUNY Upstate told me.
I haven't communicated with SUNY Upstate directly. I communicated with our disaster guy and with
I
Butch.
prefer they use you.
Yeah.
So apparently it's
That's all
what
right
we
with
were told.
us.
Well, it happened when supposedly Latour had a patient. I mean, I was getting text messages from various odd people saying, hey, you guys are transporting somebody. I said, what? Yeah, because they didn't communicate with us directly. It's kind of a roundabout way. So, but I am told that as of today, we should have a dedicated ambulance in it.
Dedicated ambulance, but not an interfacility arrangement.
I mean, it's hard because typically we would make all those arrangements as the hospital.
Right, and that's what we wanted to be sure during the tour, is that people were contacting me on text, and somebody called the dispatch at Syracuse, but it wasn't coming from the facilities.
That's what we've been told, that it
Yeah.
won't come from us. So
And
that's
we have
something
been told
the
that
State
it has to
Department of
come
Health-
from the facility, that a request must come from the facility or the Department of Health of that county.
Yeah.
It can't come from, you know, Bob's ambulance service.
Right.
We don't want to do this, have at it. It's got to come from the Department of Health in that county or the sending facility that's doing the transfer.
Okay, Joe?
Okay, we have to, what we're looking at here is, he says, she says, I do, you don't.
That's a lot.
The reality is that any call for transportation of any patient is going to come from the local health department or the state health department. The understanding is that the receiving facility, whichever facility is going to receive that patient, is going to send a dedicated vehicle to pick that patient up and bring him back to the facility. That's the concept is the understanding of the health department at this point. So,
Is this
agencies-
pre-hospital, Joe?
I'm sorry?
You're talking pre-hospital or inter-facility?
On everything.
Everything?
Who's ever receiving the patient, whichever Ebola receiving hospital is receiving the patient, will send a dedicated ambulance to pick that patient up and bring him back, irregardless of operating territory, like Mark said. The
Right.
concept is to keep a limited number of vehicles and people from being exposed unnecessarily.
So in our case, there's no point in keeping an ambulance dedicated for this transport.
Well, that's what I was getting at, but so what do we do now that we're,
Well, I would, you know, again, is that 100%? Is that 100% what's going to happen? As of last time I heard, yes, that was 2 days ago. Has it been
But the
officially-
order hasn't changed yet.
No,
So-
it hasn't changed yet. So, the concept would be that if somebody's going to Bellevue, for some reason, Bellevue will send somebody up to pick that patient up and go back to Bellevue.
But not pre-hospital patient.
Well, pre-hospital patients are a whole different story.
Right.
Well,
Oh, yeah, that's
pre-hospital
what I just
known and being monitored versus pre-hospital, oops, we just found them, are two
Yeah.
different things.
Right.
The other case, the other instance too, is the PSAP is a real key part of it. If they have what they suspect to be a case, they are not supposed to dispatch that. They're supposed to contact the local health department, let them know first. So local health can send somebody to that facility before an ambulance goes. That is the concept that they're working on.
You're talking in the facility.
No,
Even scene response?
Yeah,
The
so
piece-
someone's a person being monitored for 21 days who develops
So,
symptoms in their home, then they'd be picked up by the dedicated rig. Or if somebody responds 911 and goes, uh-oh, I think we've got a live one, and back out, then they'd send a dedicated ambulance.
So you're talking
So
coming from
you're talking
Syracuse,
two different
2
things,
hours.
pre-hospital versus into facility. Pre-hospital is exactly what that's saying. If PSAP, based on the information, thinks they have an active case, they're supposed to pick up a phone call local health department first, not the ambulance service. Pick up local health department, but the local health department is supposed to send somebody to verify. If it turns out to be an active case that's not necessarily have to go to the hospital, they may just tell them to shelter in place. If it's somebody has to go to the hospital, then they will call a dedicated ambulance to come pick them up and take them to the hospital.
so you're talking to public health of each county?
That's the lead agency.
So do the public health agencies all know this?
Yeah, Mandy told me.
They're
So
all-
ours doesn't stay in their home for 2
So
and a
they
half
have
hours.
a,
The local
then the
public
person they're gonna send out is somebody on house.
Somebody ought to check with
The
the.
incident that happened at Nathan Latour is an investigation, but public health didn't get notified until the Bureau of EMS notified the public health department instead of the hospital calling public health. It was Bureau of EMS that called public health, and it's like, what the hell are you talking about? We don't know anything about this. And that's when it all fell apart. The actual call about moving that patient should never have taken place, because first of all, the patient turned out to be not a case, not an issue. Somebody, who that somebody was, we don't know, jumped the gun and called Gayback. Gayback called me and said, what do we do? And I said, hold on, time out. And I got a hold of Lee, she was like, you gotta be kidding me. I called Dr. Urquhart, who is the public health director in the state. He said, we didn't know anything about it. It took 20 minutes for them to get to the local health department, and they said, we don't know enough about it. And that's where it all fell apart. It never should have gotten to the point where it did.
Don?
I think maybe the state health department should notify the local 911 dispatch centers that they're not to dispatch an ambulance, they're supposed to dispatch the county health departments first, because, now I'm not saying this, by the way, turn the camera on. Fulton County 911 dispatch does not have any policy regarding, not in writing anyways, that is up for the dispatchers to know about, for dispatching the public health department instead of an ambulance.
That would be an interesting survey to do of our 6 counties.
Yeah.
It would.
And I
Because
really,
this is the first I'm hearing about we're supposed to notify the health department instead of notifying the ambulance service.
I'd be curious to know if the local health department knows that they're supposed to be
Yeah.
notified first, and that they're supposed to contact the receiving facility for an ambulance and not dispatch regular EMS to it also.
Yeah.
The concept is they don't want EMS agencies, like Joyce said, a small EMS agency walking into a situation with fully crowded out service for 21 days.
Right.
That's the whole concept.
Oh, I understand it.
And
I
there's
think
no
that all
reason-
makes sense.
There's no reason to send a local ambulance service if there's a potential, there's absolutely no reason to send a local ambulance service. You know, and most of all the patients will either be too sick to worry about it, or not sick enough to have to be rushed to the hospital. You can wait 24 hours or whatever it's going to take to get them there. So the concept of just dispatching a 911 call, say, oh, by the way, we have potential Ebola case over the radio, is going to create panic. The whole purpose of it is so no communication goes out over the airways to all communication is done by telephone.
I understand, and I'm not knocking the plan, but I don't think they let anybody know that that was the plan.
Right, right.
Yeah. They may or may not go to this appointment. That is, they were supposedly every PSAP was told this is what they have to do. We're not individual.
Unless they kept that a secret and didn't trickle it down to the local EMS and ambulance agencies.
See, the only place like where that falls apart is say you've got a person who's home under 21-day investigation and they have an MI or a broken leg or something that needs a true 911 response. So there may still be the need for us to be able to protect ourselves.
Sure, that broken leg's gonna be okay.
Yeah, but I don't know if it's worth keeping an $90,000 ambulance tied up that can't do anything for, now that this plan's in place, why are we keeping an ambulance tied up, you know?
The other thing, and why are all these tiny little agencies spending hundreds and hundreds of dollars to get all this stuff in? I mean, we've had people spending a huge amount of money to get all the time, time and money to get all these supplies and equipment. And
there are some commercial agencies who've been spending 40
I
grand,
can't
100
imagine.
grand to
I
do
know.
this, you know, it's just, well,
So it's
And
up
look
to
at the money St. Mary's Hospital has spent.
well,
And
yeah.
if they're not a designated center, I mean, and that's,
Yeah, but the
Now there's
hospital's
three
still
different
good.
They're gonna be ready for that one.
There are agencies that are requesting changes to the order, agencies that represent you in terms of lobbying agencies, FASNY, NICEVARA, all have put in some stuff requesting changes. So there are attempts going on to get this order modified. So.
I like the order.
yeah.
I don't see
So-
anything
Fine
wrong
with
with
it.
it. I like
We
it.
just wanna make sure that everybody knows
You
what
have-
the plan's
yeah.
supposed to be.
And I really think the chance of walking in on a surprise case, I think overall the United States has managed it well by by allowing people to continue to come in from those countries to ports, identifying them and tracking them, rather than just, there was this great call, well, let's not accept any flights. All that would have done was created a black transport market. These people would have paid to be snuck into whatever
They say
there
that's
is.
still happening anyway. We heard that from our own public health department, and that some airports are not nearly as strict in their isolation and quarantine and screening policies as JFK. So they're flying into other airports and then coming up.
Well, with regard to this new policy that Joe was just talking about, it seems to me that perhaps the commissioner of the department and the bureau have taken the comments they've received and said, well, let's rethink this. And I think it does make some sense.
It does, but what has to happen is that people have got to be informed about this
People need to
because
know
there's so
about
much
it. Right,
confusion
exactly.
about it.
Well, it's right from the get-go, it's been a knee-jerk reaction, and a lot of people want to start their own plans and all that stuff, and so that's why you got to have this central training and information coming from one source.
Yeah, because I know from just my communications through the Ambulance Association, we got a letter that ACEP has written, emergency physicians, to the commissioner requesting some modifications to the order because of all of the things that we've been talking about, and they've asked us to sign on to that, which I believe we're going to do, as well as NICEVARA sign on, I think state chiefs and fire community sign on to that as well.
Okay.
So can we get a copy of that policy, or where do we go? I mean, how do we inform our own? How are we sure that our 911 dispatch centers know that that's the policy?
Yeah.
Where does that come from?
Phil.
Definitely comes from Phil.
Yeah, if I get a copy of it, I'll be glad to send it around.
I'll check into the public health, as far as I believe public health preparedness, I believe.
All right, if you could give me a link to it or a copy of it, however you want to do it, Joe. I would appreciate it. receive, I will send around.
That's what I said.
And I will resend the policies and procedures that we were talking about this morning, the guidelines for agency acceptance of a policy and procedure. I'll send those around again this afternoon when I get back to the computer.
Okay, thank you, Bruce. Anything else on REMAC from last
I
month?
just have a question relative to that discussion. Do all the PSAPs have appropriate questioning of anybody that calls in
That's a good question, too.
and dispatch?
I
They
think-
have the screening questions to identify
I
this.
think all of them have copies of what questions should be asked, whether or not they are actually implementing it, I don't know.
I can tell you they all aren't,
They're not.
because I know one that's not.
It goes back to the medical liability of it, and medical director has to approve those questions in order to cover it under that liability. So, depending on who your EMT dispatch is through, you have to go through those questions, and those questions have to go to your medical director to be approved, and then to be trained, and then to be implemented into the system. If that's not all done, then you've opened yourself up to a liability. So it's kind of like everything else here. It's a slow train to finally get there.
A question for Joe. Are there still only 2 dedicated hospitals, upstate and Bellevue?
There's 2 in Buffalo now.
There's 10.
In that, there's a
Is
complete
there-
list
is
in there.
All right, I'm sorry, I missed that.
Yep.
All right,
There's a
very
complete
good.
list as of yesterday.
Okay.
They added 2 in Buffalo after the initial 8 we were told about.
But some of them only can take one patient.
Oh, yeah.
Anyways.
Anything else, Dr. Hunter? Alrighty. County reports. Delaware?
We have 2 EMT classes still going on once a day.
Crazy scenario.
So hoping things are going well with that. We put in approval for an AMT course.
Otsego?
Nobody here?
Nobody here. Schoharie?
Nothing to report.
Okay, Montgomery?
We were notified yesterday that Mid-County ceased operating as of December 1st. So it's not that big of an impact. So we'll manage that fine, but the letter was a little late, but it's okay. And we did drill yesterday with Public Health, County Office of Emergency Management, GAVAC, on an Ebola patient that had walked into our ER. That went really, really well. That's it.
Thank you.
Could I ask, while we're still on that subject, could I ask Joe, do we have anything in writing about Mid-County surrendering their operating certificate yet? Nothing in writing.
Isn't there something in place though that if an agency like that is gonna stop service, that
Yeah, there's a
other
whole policy,
agencies?
there's a whole policy statement they have to follow.
Yeah.
Paperwork and that type of stuff. They're supposed to follow stuff like that.
If they did it the first time.
I mean, they shut their doors down already. If they don't, they've already closed their doors.
The letter yesterday was CC'd to New York State Department of Health, Sheriff's Office, and AAREMS.
I know Phil said he got a letter said it didn't go into
They didn't
I
go
didn't
on.
get a letter.
It might still be in the mail.
It must
The
be-
issue,
it was
the
like
issue
yesterday.
is whether or not, if they close the door, what we can do, and the answer to it is not, we don't necessarily do anything for the state's attorney general can. You're a not-for-profit corporation, there are specific guidelines, if you don't follow those guidelines, the ramifications can be dramatic.
Yeah.
We really, is it up to us if we get their certificate, they haven't done it for 6 months? Make a difference? No, it becomes an issue for the state attorney general. So,
Tony, when
they
did
know
you get that letter?
It would be in their best interest to do it.
Yesterday.
I got the email today.
Oh, an email? Okay, I did not check my emails this morning.
I got the email today, the letter is dated,
Dated the first, the very bottom under the signature, I think.
yeah,
1st of December?
Yes.
Yeah.
Oh, I definitely have received nothing.
Okay.
About that?
Alrighty.
Okay, Fulton County.
Nothing new.
Hamilton?
We haven't had a meeting.
We got a research basic going now in the lower end. In January, we're starting a couple of research on Blue Mountain Lake. And big meeting yesterday with some federal guys, state guys, FEMA, SEMA, and the National Weather Service, national, worldwide, and local disasters. And the only disaster we have is the Adirondack Park, which is driving everybody out of there. And other than that, things are fine.
Okay. Thank you. Any old business?
Could I just make another request? Please, if you know of an agency in your general area of operation that has not been receiving my email regarding Ebola or whatever, please contact them to send me an accurate email address, please. I would appreciate that.
Okay. We have any new business for this council?
We have a birthday girl sitting around the table right there. Today is Jill Dunham's birthday.
She's well marked.
Hey, happy birthday.
Well, happy birthday.
That's worthy of mention. That's why I'm.
Lou,
Queen for a day.
That's right.
25? I must have been 25.
I am, yeah, just turned 25.
Yeah, I must have been 25 because now I'm 26.
Which anniversary of your 25th birthday is that?
It's called
25 years with experience.
Yes, Pat.
I want to ask a question at the council, and if somebody wants to, discuss it afterwards, that's fine. As a receiving facility, we're having an issue with a local agency with the EPCRs, and I didn't know if that's something other facilities are having an issue with. If the process that they're telling us has to occur is, the normal process. It's quite a challenge.
What are you getting at, Pat?
Well, yeah, not you guys.
No. But
There's an agency that brings patients to our hospital that's EPCR, and ever since they became EPCR, we had trouble getting the document itself.
okay, that's what.
So we've been back and forth several times, and the solution was they gave us what he's telling me is they have two vendors. The vendor that provides the EPCR document itself and a vendor for the billing piece. So the EPCR, when it's completed, goes to the billing vendor, and the billing vendor is responsible for faxing it to the receiving facility. So needless to say, it's a while before we ever get it anyway, once we clarified that we actually needed to get them. So we were,
I'm sorry, go ahead.
So I'm just wondering, is that the normal process? Does it depend on the vendor? Does it depend on the
Not
billing
compliant with
agency?
the policy that way.
Right,
Beth
there's
can
a
probably
DOH
answer that.
policy. It's not actually a policy, it's called what is the New York State memo on this very subject?
No, it's a policy.
Oh, it is a policy?
There is a
from
policy.
2003, right?
There's a policy on EPCR, yeah.
Yes.
I can't remember the date.
1203.
Pat, I will send you in today's email this afternoon when I get back. I'll send you Mike Taylor's email address. Contact Mike Taylor at DOH and present him with this difficulty. He'll settle it very quickly.
Okay.
Yeah, he'll settle it. He wants to know about such things. He will settle it very quickly. He's the EPCR man down at the EMS Bureau.
Okay. Because what they're saying is, well, they'll leave us the EMS 9s until such a point that we can get, or something like it, until such a point that we can get the PCR. It just seems like it's not a very good process.
No, there's a breach of process there.
It is, a few years ago, we had this problem down at the hospital in Sydney, when Susquehanna region went to EPCRs, and we weren't getting anything. We had no way to get anything from them. I talked to, what was his name, worked down there, took Sonia's place, down in Broome County.
Ray Serwick.
Ray Serwick.
Ray Serwick, yeah.
And he told me that if the hospital wanted to pay for a station, then when they come in, they could download the PCR in the hospital. And I said, well, the hospital is going to pay for that station. That's not our responsibility. The hospital's legal advisor came back with a policy from New York State stating that all Article 28 facilities, when an ambulance transports that patient to an Article 28 facility, they are required to leave a copy of the run report at that hospital. Now, if they don't leave a copy, then there must be some way where you can contact that agency and they can email you a copy. But there is a policy in place that states that all hospitals have a right to have a copy of the PCR left with the patient.
Or documentation with specific information, because I did read that policy, pardon me. I guess my question is, how long are you supposed to wait to actually get a PCR?
The agency just needs to figure out a way to use the vendor they're using for the PCRs to fax it or email it to you before they get it to their billing. That's what all the other ones are pretty much doing. When the PCR is complete, we send it to the hospital and then it goes to billing, and
I thought that was kind of a weird way
that
of
can
doing
take
it.
days.
I believe the way it's worded is that you have to immediately leave. There's 5 things: demographics, assessment, vital signs, treatment rendered, and one other. And you have to leave a copy or complete an electronic transfer of the PCR. It does allow for the electronic.
Correct.
Right.
But it's at the time of the handoff, right? And there's coincident.
It says that, and it says further down in the policy that once those 5 things are handed off, that the person has till the end of the shift to complete their PCR.
Right.
So that would be your time frame, and that works for shift type ambulances. To me, for the volunteers, it would be going back to your station, finishing it before you walk out at the end of the call. So, but it does.
It's a minimum data set that's expected at the time the patient is dropped off.
Correct. And that's why they were using the little EMS 9 forms or something like that to at least give us that information.
I'll send you Mike Taylor's
I wrote his name down.
email, and he will handle that very quickly. He wants to be informed of such situations.
I can tell you that from personal experience that if the volunteer agency is involved with a something that has legal ramifications right away, like if it's a crime scene investigation or something like that, and they don't complete that PCR, their lawyer will be talking to somebody else real quick.
Appreciate the information, everybody. Thank you.
Any other new business? If not, we need a motion for adjournment.
Phyllis, you mentioned there might be a member that might not be a member.
Oh, yeah, this is Chris Georgia became a member of our agency, of our region, through the Fulton County EMS Advisory as the manager at Fulton County Ambulance. He's no longer the manager of Fulton County Ambulance. He resigned last week. So, beginning of this week, I forget which, but in any event, he's no longer a member there, so I do not know what his membership status is at the present time. I don't know whether I have not received a resignation from him directly from the regional council, but I do not know what his membership status is at the present time, simply because he's no longer associated with the ambulance service of Fulton County. I would really have to contact him. In other words, he went to the EMS Advisory Council and asked me for nomination. He's kind of in limbo right now.
Would it be proper to write
I
a letter?
wrote the name down. I figured I could put that.
Yeah, unless,
He still might be the manager of Grand Albany.
I'm sorry.
He still might be something with Grand Albany.
I honestly don't know. That's a very good question. I truly don't know. I will attempt to find out.
Anything else? Motion to adjourn? Second? All those in favor, signify by saying Merry Christmas.
Merry Christmas, everybody.
Happy Christmas to one and all. And a Happy New Year, that's right. We won't be back in 2015.
And a safe trip home. Yeah, we'll see you all next year.
January 15th, 2015.
I haven't done anything more.